Hello, sir.
Hi, come. Hello. Come. Vanakkam.
Hello, sir.
Andhra Pradesh.
Payan.
Yes, Payan.
Payan, sir.
I. Okay, relax. So, English or Tamil? English.
I don't know Telugu.
Okay, so we'll talk in English only. So, what is your main complaint now?
Sir, actually my problem is the jaws are not inclined, not injected correctly.
Yeah, correct.
So I'm not able to chew food properly and eat properly. So that is one physical problem, and I don't have any self confidence. Like I don't have good smile,
Yeah,
facial proportion.
correct. So, see, both are related to the position of your jaws.
Yes, sir.
Your upper jaw, lower jaw is not in the right relationship. If you look at is your father?
Yes, sir.
See how the face height is there?
Yes, sir.
Your face height is small. From the eyebrow to the lips is this much for you. For him, it's more. For me, it's more. So we have to do surgery on both your upper and lower jaws and increase the facial height. Both here, also here. Then the nose will be gap between nose and lips. The whole thing we can change. But it needs a bi-jaw surgery. And it will take for you about 1 week to 10 days here in the hospital and the recovery of 3 weeks. But whole face will change. It will become very proportional. Your eating also will become better. Your that pain, everything will become problem solved. அதெல்லாம் சரியாகும் because our problem is severe here.
Yes, sir.
இதை நம்ம கரெக்டாக போட்டோம்னா மெயின் அதுக்கு ரிலேட்டட் ப்ராப்ளம்ஸ் எல்லாம் சரியாகும்.
Sir.
சரியா? When do you want me to do this, bud?
Tomorrow onwards, you will eat.
Okay, we will plan day after tomorrow then.
English, sir.
Huh?
Chewing the food and
No, it will be less. All the problem will come down. The headache, the pain, and all will be less now after surgery. Maybe not there.
So how much it take to reduce all the effects?
It will take 2-3 months total for you to see the full difference.
Okay.
You are having snoring now when you sleep.
Yes, sir.
That also will be corrected.
So actually one more problem is I need to join a job on July 3rd. That will be a problem.
No problem. 1 month is there, no problem.
பணம் பிரச்சனை இல்லை சார். தலைவலின்னு ரொம்ப
இல்ல அவங்களுக்கு வேற நிறைய ப்ராப்ளம்ஸ் இருக்குல்ல, தாடுனால ப்ரீதிங் ப்ராப்ளம், ஸ்னோரிங் ப்ராப்ளம், சூயிங் ப்ராப்ளம், அதனால அப்படி இருக்கு ப்ராப்ளம். அதெல்லாம் சரியாயிடும். எல்லாம் சரியாயிடும்.
According to your estimate, how much it will cost?
They will tell you exact cost for the whole procedure. Huh? You have to have a shave and everything. You already contacted them before?
Yes, sir. Online consultation.
So they will do the same thing.
Okay,
In online consultation, you only taken, sir. You only said that I have to go bypass.
Correct. So
அது கீழே ப்ராப்ளம் வந்து மேலே வந்து நல்லா இருக்குன்னு சொல்றாங்க.
ஆஹா, அப்படி பண்ணீங்கன்னா சரியாகாத ஒரு ப்ராப்ளம். இத மட்டும்
He
பண்ணீங்க.
told me, sir, morning. The problem lies in the down part.
No, problem
காலையில் ஒரு சார் நான் பார்த்துருக்கேன் சார்.
ஆனா அவங்களுக்கு தெரியாது ரெண்டு ப்ராப்ளம் இருக்கு.
ஓகே, అంటే கீழே ப்ராப்ளம் கீழே சரியில்லை, மேலே நல்லா இருக்கு.
இல்ல, மேல also problem is there. Other we cannot correct. If you do only genioplasty, no pain, nothing will be solved. Only you look little better.
Yes, sir.
But everything if you do, full thing will change. Smile nicely. More. So we have this guy here. His main concern is his face is too small. It doesn't match with his body. I think you can observe and appreciate that. So what we planned for him is I'm going to first show you his facial shape. This is his upper third of the face. This is his middle third, and this is his lower third. So So this is really large, not as large, very small. First issue. Secondly, when you look here, it's square. It's like a box face. This is 90 degrees exactly. I've got a scan up for you, and you can see here, this is what I'm trying to say. And also the height of the anterior third of the face is less. The bones are not projected enough. Smile. You cannot see his teeth when he smiles. Show you a bite, and his bite is not alright. So there are multiple things happening with his face, both with his soft tissue and mainly with his bony skeleton, involving the two jaws, upper and the lower jaws, also involving the various other proportions in the face. So what we're planning for him is to increase the length of this face. This is going to be increased by 2.5 centimeters. Yes, it's going to be a major improvement for him. And how are we going to do that? We're splitting this increase in vertical height, half in the upper jaw and half in the lower jaw, or actually 40% in the upper jaw and 60% in the lower jaw. So it's going to be the upper jaw, we're moving it forwards, we're doing a clockwise rotation and giving a gap, so this height increases. The distance between his nasal tip and lip will increase. His lip shows less, so we can increase his lip length. So multiple things there. Moving on to the lower jaw, we're going to be working on the angle, osteotomy, and this angle eventually is going to be like this. It's going to come down and here, about 120 degrees. With the chin, very short, and this projection is now nice. There's a curvature. It's going to go in. This is going to get this angle, and this height is going to come up. Lip is going in. Plus, this bite is going to be changed. So I think from what I have just told you, it's pretty much like a face makeover surgery. We're not going to do anything with his eyes, but even the nose shape, the lip position, the cheeks, the angle, and the lower jaw, entirely, everything is going to be changed. We're going to be giving him anesthesia to this side. It's going to be a transmyeloid or a submental intubation, so we can work on the whole face. And we've made mock surgery. We've got the splint, the wafers ready. And we're expecting the surgery to take anywhere between 4 and 5 hours. He's going to stay with us for a week. That's what I've told you. And recovery will be 3 weeks in all. And we try and show you the various stages while he's in the hospital. So this is our smiling patient before a face makeover surgery, and this is the same patient under general anesthesia. We've done work on the upper jaw, base of the nose, chin, lower jaw, and that's the change. We're also going to show you some more pictures of him before, and we're going to show you the side view. So you can see he's got nice proportions now to compare to what he had. So his upper jaw was deficient, so was his lower jaw. All the anatomical structures around the nose, upper lip, lower lip, chin, angle have all been made better. You can see the proportions have been increased, augmented. I'm going to show you the front view one more time. Him smiling. Now this is right now.
Okay, that is normal. Bleeding and a little swelling after surgery, it is all normal. Okay.
நிறைய வருது இந்த பக்கம் கம்மி சார் வலி இந்த பக்கத்துக்கு கோட
It's okay. It is normal only. Nothing to worry. Okay, surgery is done here only, right side. So it's been 2 days now. It's second post-operative day following a bi-jaw surgery. So he has a little bit of swelling, but there is significant improvement in the profile. He says there's no bleeding as such, but he has a little bit of pain on the operated side. We have done some osteotomies the back side of the lower jaw. So the pain will come down, but he doesn't have much swelling like other patients have. His profile is improved. What are you taking? Fruit juices. Okay. Do you have any doubts? Stitches. What happened? What is your doubt?
The doubt is like teeth are there, no?
Uh-huh.
Yes.
Okay. Yeah.
The lower teeth will come forward or raise the position, that is the fine.
Okay. Can you bite now? So due to pain, you're not able to bite
Mm.
properly. Okay. So this is not final bite. Once the pain and swelling comes down, we'll call you down. Okay. We'll check your bite. Okay. So don't worry about that. Because of pain, you're not biting properly. It will come normally. Before, like how it was before, like that only it will come. Nothing to
Should
worry.
I have to put on braces also?
No, not required as of now. Okay, let's wait for another 3 days. Swelling comes down. We'll check your dental teeth and everything, and then we'll take a scan.
Mm.
Okay, as of now, it's not required. Okay, we'll let you know. Any other doubt you have?
So how do you look like according to you?
Like what?
According to
Ah,
face, profile, and
see, all this swelling here, like around 8-9 mm, will come down. Here also, whatever soft you're feeling, everything will come down. You will be able to, feel the jawline. Okay, this swelling and this projection, this chin also you can feel. All of these are swelling. Okay, you have to wait for another 5 days to see the result. Okay, all right, bye.
Thank you, sir.
Yeah, welcome.